Welcome to this explainer. Today, we're diving into a pretty amazing intersection of technology, psychology, and facility management. We're looking at the new gold standard for optimizing healthcare spaces using advanced wall mural technology. Because, we're moving away from those sterile, anxiety-inducing rooms. Instead, we're building spaces that actively support healing and operational efficiency. Here's our roadmap. We'll start with the care environment dilemma. Look at healing through visual design, and then map out strategic placement for maximum impact. After that, we're going to cover high hygiene and safety standards and wrap up with how to pull this all off with zero clinical disruption.
So I want to start with a question that might sound a little out there at first. Can a blank wall actually improve patient care? For decades, right, facility managers and hospital administrators have looked at empty walls as just structural boundaries. But what if we start seeing them as an underutilized, absolutely critical component of the patient experience? In healthcare, the physical environment is literally a part of the care you provide. An empty corridor isn't just a hallway, it's a missed opportunity.
Section 1, the care environment dilemma. Let's look at how physical spaces directly impact medical outcomes. Think about your traditional medical setting, the constant beeping machines, the harsh fluorescent lights, those stark, empty walls. It's inherently a clinical institutional space. And let's be totally honest here. For a patient or a stressed family member, that classic doctor's office beige naturally kicks anxiety into overdrive. The shift from that cold, sterile standard to a calm, human space is just absolutely crucial. Custom murals act like a bridge between these two experiences. They have the power to instantly warm up a room, making it feel way less like a clinical factory and a lot more like a supportive, healing environment.
So how do we actually pull off this transformation? Well, the answer lies in the specific technology redefining our industry, direct-to-wall printing. Now, we're not talking about hanging up a framed poster or slapping up some giant wallpaper stickers. This is the process of taking custom, large-format graphics and printing them directly onto the drywall of a medical facility using specialized low-odor inks. Understanding this exact mechanism is key. It's what lets us completely bypass the usual limitations of traditional decor and actually integrate design right into the DNA of the building itself.
Section 2, Healing Through Visual Design, the psychology behind healthcare murals.
These graphics, they do so much more than just decorate a room. They serve a profound clinical and psychological function. First off, we see a tangible reduction in stress. Studies in real-world applications consistently show that soothing, photorealistic nature imagery physically calms patients down in waiting areas. Then, think about pediatric comfort. Friendly, engaging scenes can instantly ease the anxiety of a kid walking into a clinic. We also use these murals for clear wayfinding, leveraging distinct visual cues to help overwhelmed visitors navigate those massive, maze-like hospital corridors. And honestly, perhaps most importantly, during actual procedures or in imaging rooms, these murals offer powerful positive distraction. They give patients something engaging to focus on other than all the scary medical equipment. Ultimately, it all adds up to a warmer, vastly more human environment for the patients. And let's not forget the incredibly hardworking clinical staff.
Section 3, strategic placement for impact. This is all about mapping design directly to facility operations. Now, what's really interesting here is that true expertise means mapping the exact psychological benefit to the specific clinical location. It's like a giant puzzle. In waiting rooms and lobbies, your primary goal is a warm welcome and immediate stress reduction, right? It sets the tone for the whole visit. But move into the corridors and elevators, the high-traffic routes, and that operational goal shifts entirely to wayfinding and keeping people moving calmly. Over in imaging and procedure rooms, the clinical priority becomes positive distraction, keeping patients still and relaxed. For pediatric clinics, it's all about playfulness to ease a child's fear. In behavioral health units, the absolute priority is creating deeply soothing, safe, and supportive environments. You've really got to deeply understand the unique operational needs of each hospital wing to design the exact right visual solution.
Section 4, High Hygiene and Safety Standards, meeting the strict demands of medical spaces.
Look, all the beautiful design in the world means absolutely nothing in a hospital if it isn't safe. Direct-to-wall printing relies on UV-cured, VOC-free inks. VOC stands for volatile organic compounds. Because these highly specialized inks are completely VOC-free, you get zero off-gassing and no strong chemical odors. Maintaining safe, pristine air quality for vulnerable patients is an absolute non-negotiable. This specific technology guarantees that we are never introducing harmful fumes into a sensitive medical environment.
So, the crucial point here is how this directly translates to infection control. The ink bonds right into the wall itself, giving you a smooth, completely seam-free surface that is highly cleanable and scuff-resistant. Why does that matter? Well, with traditional vinyl wraps or standard wallpaper, you've got seams, you've got edges that, let's face it, eventually start peeling. And in a hospital, a peeling edge is basically a dangerous trap for dust, grime, and bacteria. By ditching the vinyl film entirely, direct-to-wall printing completely eliminates that breeding ground for hospital-acquired infections. It is literally a game-changer for your environmental services teams.
Section 5. Zero clinical disruption. Installing without interrupting patient care. Anyone who has ever worked in healthcare administration knows the absolute nightmare of a remodeling crew. You can't exactly press pause on an emergency room or a busy pediatric clinic for renovations, right? 5. That is the number of hours it typically takes for a single-wall, direct-to-wall mural installation. Under 5 hours. And because of that UV curing process we talked about, there is absolutely zero drying or curing time required once the machine stops printing. The space is instantly, and I mean instantly, ready for patients. And this brilliantly illustrates the step-by-step reality of how this works on the ground to maintain perfect clinical continuity. Step 1. We schedule entirely around facility operations. Evenings, weekends, basically whenever traffic is at its lowest. Step 2. We execute that rapid, fume-free installation. Step 3. For those massive, multi-wall projects, we strategically sequence the work so that major areas of the clinic always remain open and fully functional. And Step 4. An immediate return to clinical use. It's flawless logistical planning that keeps the medical facility totally operational while getting a massive environmental upgrade. Executing these highly specific, safe, cleanable, and zero-disruption transformations requires dedicated specialists. Right now, this work is being spearheaded by groups like Coast Mural Pros. They're out there designing and installing these custom healthcare murals across NYC and the entire East Coast. They are proving day in and day out that this high level of facility optimization is accessible, incredibly practical, and highly effective for modern clinics. Which brings us to this final provocative thought. And it's a question I really want every facility manager and healthcare professional tuning in to sit with. Your walls are undeniably a part of your care environment. So what are yours currently doing for your patients? Are they causing anxiety, or are they actively contributing to healing and calm? It's really time to rethink our physical spaces. Thank you so much for joining me for this explainer. Now go take a closer look at those empty walls.